How is joint inflammation diagnosed by doctors? Have you ever wondered how doctors determine if someone has joint inflammation? The process is quite detailed and involves several steps. First, a doctor will take a thorough medical history. This includes asking about symptoms like joint pain, swelling, tenderness, redness, warmth, and any limitations in movement. These symptoms are crucial for understanding the patient's condition. Next, the doctor will perform a clinical examination. During this exam, they will check the affected joints for tenderness and swelling, which are key indicators of inflammation. They will also assess how well the joint functions and look for any deformities or instability. If the patient has systemic symptoms, such as fever, this may suggest an infection or a systemic inflammatory disease. Imaging techniques play a vital role in diagnosing joint inflammation. X-rays are commonly used to visualize joint structures. They can help detect changes related to conditions like osteoarthritis, such as cartilage loss, bone spurs, and joint space narrowing. Doctors often use the Kellgren and Lawrence grading scale to assess the severity of osteoarthritis-related degeneration. Musculoskeletal ultrasound is another valuable tool. It can detect joint swelling, synovial inflammation, and fluid accumulation with greater sensitivity than a physical examination alone. In some cases, doctors may use magnetic resonance imaging to obtain detailed images of soft tissues, cartilage, and bone marrow. Laboratory tests are also essential in the diagnostic process. Blood tests can identify markers of inflammation, such as elevated C-reactive protein or erythrocyte sedimentation rate. If autoimmune arthritis is suspected, specific antibodies may be tested. Additionally, joint fluid analysis, known as arthrocentesis, involves extracting synovial fluid from the joint. This fluid is examined for signs of infection, crystals, or inflammatory cells. Differential diagnosis is crucial for doctors to distinguish between various causes of joint inflammation. They need to differentiate osteoarthritis-related inflammation from conditions like rheumatoid arthritis, gout, bursitis, tendinitis, or infections. This distinction is important because the inflammation in osteoarthritis is typically due to cartilage wear and joint degeneration, rather than systemic immune responses. It is also important to note that joint inflammation can vary significantly among patients. Some individuals with advanced osteoarthritis may experience little inflammation or pain, while others with mild joint changes may have significant symptoms. In summary, diagnosing joint inflammation involves a comprehensive clinical assessment, supported by imaging studies and laboratory tests. This thorough approach helps confirm the presence of inflammation, identify its cause, and guide appropriate treatment. By accurately distinguishing between osteoarthritis and other inflammatory joint conditions, doctors can develop tailored management strategies that best suit each patient's needs. Always consult a healthcare professional for personalized medical advice.